Greetings of the day, everyone. I'm privileged to welcome you all into the Health Talk series organized by the Student Council of Sadabai Raisoni Women's College, supported by SGR Knowledge Foundation and powered by Raisoni Group of Institutions. Most people with fear of dentists must have heard some dental myths or horror stories at some point in their lives which affected their consciousness. Such dental myths can affect a person's perception of a dentist and what he does, causing him or her to put off visits to the dentist. This could lead to the serious oral health issues and long-term dental problems, which could result to painful dental procedures. So, today we have Dr. Amrita Gogia with us, we, who is stepping away from our usual discussions of dental conditions and treatment to take a look at some of the unusual beliefs and, and facts related to your mouth throughout history. I welcome you, ma'am.
Yeah, thank you, Maria. So I am Dr. Amrita Gogia.
Ma'am, I'll introduce.
Yeah, please.
Dr. Amrita Gogia is a BDS MDS Pediatric Dentist from PGI Chandigarh in 1991. She has completed her mastership course from Roseman University, USA in TMD Orofacial Pain and Dental Sleep Medicine in 2021. She is a diplomate of American Board of Orofacial Pain in 2022. Presently, she is the head of Department of Dental Science at Medanta. She has remained a senior consultant for over 15 years at Dr. L.K. Gandhi's clinic, South Extension, Delhi, which is one of the most elite and professional establishment in Delhi where she has been practiced. She has been a professor and has taught at various dental colleges. She has areas of interest in pediatric dentistry, preventive dentistry, root canal treatments, temporomandibular joint disorders, airway dentistry, dental sleep medicine, orofacial painful. I must say, ma'am, you really have a wonderful CV. Really, ma'am. Ma'am, you already have so many feathers in your cap and yet to come. I welcome you, ma'am. And now, without any further ado, I would like to hand over the session to you.
Yeah, thank you, Maria. It's a pleasure to be here on this platform and addressing all of you. So today I am going to talk about various dental myths. As you just mentioned, that a person is very, very scared to go to a dentist. And we actually call it as a dental phobia. And these phobias,
Yes.
they become or they come into you, or these fears come into you when you're a child. So being a pediatric dentist, one of our biggest role is not to create phobias in children so that they can easily go to a dentist when they are older in age or even as a child. So that is one of the main uh, areas that we work on as a pediatric dentist. So we
Yes, ma'am.
want very healthy children, fearless, who don't fear dental treatment at all. So let me start. Today I will be talking about different myths concerning cavities, gum problems, irregular teeth, wisdom teeth, implants, what happens if I extract my tooth, or something about smile design, as an adult, how can I help? How can I have a better smile? So let me start my presentation and then we will go about it.
Yes, ma'am. Sure.
Okay. So today we are going to talk about all about dental myths, as you said. So first, I will give you a oral health and overview of what I'm going to talk about. I will talk about dental caries, cavities, both little bit in children and mainly in adults. The gum disease, what as a common name you might be calling it as pyrrhia or gingivitis. Then comes the malocclusion or the irregular teeth, or when your jaws have not grown properly, both in adults and children. Extractions, especially wisdom teeth, which your age group would be facing nowadays. Implants, that once the tooth is extracted, how do we replace it? Then a very upcoming field of dentistry that is called as airway dentistry. That is what I'll talk a little bit about it, and about snoring and your airway health. Then we'll come a little bit about talk little bit about the discolored teeth or aesthetic part of the dentistry or the smile design and various myths around it. So let's start with one of the most common dental diseases, that is the cavities. I'm sure you've heard about it. We all know what cavity is. So very, very common thing, a person when they come to our clinic and when we tell them that you have a cavity, they're surprised. How can I have a cavity? I don't have any pain. There is no problem. So why are you telling me that there are cavities in your teeth? And if we tell them, no, your cavity is very deep and it needs a root canal, they are literally shocked that why do I need a root canal? So let me bust this myth for you.
Okay.
Let me just educate you a little bit that why is it this that the cavities, some cavities are painless and you won't even know that they are happening in your mouth. So before that, let me tell you about little bit about the structure of the tooth. So this pink thing is where all your nerves, your vessels, or the core of the tooth is. This is like an empty space here, which is surrounded by two different layers of the hard tissue. The inner layer is called dentin and the outer layer is called enamel. Enamel is the hardest structure of our body. So when you have cavity in enamel, enamel really doesn't have much nerves, or I would say hardly has any nerves. So when your cavity is in the enamel, you will not feel any pain. It's only when the
Okay.
cavities reaches dentine that you start getting some sensitivity to cold, or you may feel little bit of pain. And usually, when the
Mm,
cavity has gone here till the third layer, till the nerve, the pink area is all filled with nerves and it is called as the pulp chamber. So, when your cavity reaches this inner layer where all your nerves are, it becomes painful. So, when your cavity is either in the enamel or dentine, you just do a simple filling and you get away with it. But when, if your cavity has reached the pulp chamber or the nerves inside, that is the time when you actually need a root canal. And a patient would normally come to a dentist with pain. Either your cavity is very deep or it has already reached the nerve, it has already reached the root canal stage.
mm-hmm.
That is when you really approach a dentist. That is why when they come to us and when we tell them they have cavities, they don't believe us.
Yes.
So this is the first structure which is affected. This is the dentine. And when you go to a dentist at this stage, even if you don't have pain, the answer is very simple. That is just filling up your tooth. But if
Mm,
your cavity has reached the nerve, your whole this structure becomes infected, and then you end up with a swelling, you end up with an abscess, you end up with severe pain. That is when your cavity would need a root canal and not just a filling. So that is why
yeah.
we keep telling you must visit your dentist regularly, so that even if the cavity has just started and it is in enamel, we can pick up those small cavities and fill them up for you without any pain and without losing much of your tooth structure. Another myth which is very common is, I brush my teeth every day, then why am I getting cavities? Or I do not eat chocolate sweets, then why are cavities happening? So let me give you a small, again a little educative this thing about why and how cavities happen. So it is the cavities, we all have bacteria in our mouth which we call as cavity forming bacteria. So when these bacteria, they come in contact with sugars and carbohydrates, they create or they produce acid. It is this acid which, when it comes to the tooth, it starts dissolving the tooth and then you get a cavity. So when we have to control cavity, we have to control the bacteria. We want to reduce the number of bacteria in your mouth. We want to reduce the sugars so that the bacteria can't feed on these sugars and convert them into acids. So that is where how the prevention happens. And we will talk about how to prevent these cavities. So first and foremost, as I told you, they feed on sugars. Some sugars we
Yeah.
all know that they are sugars, like we all know this, everyone knows that these are sugary things and we should not be eating them. But
Yes.
we don't know that there are certain hidden sugars also, like in ketchup. Who knows, who you don't realize that ketchups are so sugary. Then there are some healthy sugars, like in fruits, but they are still sugars. They also still give you cavities. Then we don't count sugar that we put in our tea, in our coffee, in our Horlicks, or there may be so many ways that you can have hidden sugars. Even your mayonnaise, your pizza toppings, they all will have sugar. So it is the for cavities, or for us to control cavities and to prevent cavities, we need to restrict the number of sugar exposures. Mind you, what I'm talking is the number. Number means how many times you are eating your sweets, not the quantity. So, I'll give you an example. If you get a full bar of chocolate, it is less harmful to have one full bar in one go rather than having one small bite here, one small bite in the afternoon, and one small bite at night. So, we want to count the number of exposures rather than the quantity of sugar that we are having. Like fruits is something which we cannot take out of your diet. So what we suggest is that even if you want to have your sugars, you can really have them intelligently. As a dentist, we want that you should restrict your number of sugar exposures to 3 times a day. So if you're having maybe fruit once a day or twice a day, you can have or club your other bad sugars like cookies, like your chocolates, along with your fruit, so that when you combine them, you're having only one sugar exposure out of it. So that is an intelligent way to have sugars. It's not that want to deny you of all the cakes and the chocolates and the pastries, but you can always eat them a little more intelligently. So count the number of your sugar exposures, including the Bonvita, the coffee, the sugar that you put in your tea or coffee. And then as an intelligent person, you bring down your sugar exposures to 3 times a day. That is one way of controlling your cavities. So this is how you can prevent cavities, and how can we decrease the number of bacteria in our mouth. They can be decreased or preventive by brushing our teeth and flossing. So it is not just only brushing, but we also need to floss to have a complete oral hygiene. Brushing will only clean the three surfaces of the teeth. That means what is outside, what is inside, and what is on the top. But between the teeth, the only way you can clean is by flossing. So one should brush the teeth twice a day and floss once at night before going to bed. And you should be using a fluoridated toothpaste. Fluoride is something which actually hardens your tooth surface and it prevents you from getting cavities. So you brush your teeth twice a day with fluoridated toothpaste and use a mouthwash twice a day and do floss your teeth every day. So this is how we can prevent cavities, that is by restricting the number of sugars, brushing your teeth with the fluoride toothpaste, floss your teeth once at night and use a mouthwash regularly. If you're doing all these things, add to it your every 6 monthly visit to a dentist and you can really prevent cavities to quite an extent. So there is a very big myth related to cavities in children, that children have milk teeth and they don't need treatment, which is again a myth. When you have children, because their teeth are very small, their enamel is very thin, their dentin is very thin, so the cavities reach that the nerves so easily that when they reach a dentist, they actually need a root canal treatment. So even for children, they should be doing all this what I have just talked about. That is prevention. And once they get cavities, they need to be treated just like an adult tooth. So this is what the fluoride can do. And fluoride, can you see these white areas? This brown, slight brown areas, this is how the cavity starts. This is how the tooth starts dissolving. And when you do all that I've told you, control your sugars, your bacteria, your brushing, and put fluoride, this is how the tooth surface can re-harden and become healthy all over again. So, for us to prevent caries, for prevention of decay, as a dentist, you can go to a dentist who will apply fluoride to your teeth regularly so that the cavities are prevented. And especially for children, you can do something called as sealants, where we seal the grooves, especially of the newly erupted adult teeth, and no food should stay in those grooves. And that is how you can prevent cavities in children, especially when they are getting their new adult teeth. And you must visit your dentist. The child should visit every 3 months, and an adult should visit every 6 months. If you are doing this, I'm sure both your gum disease and your cavities can be checked and can be kept under control. Now I will come to again another very common gum disease, that is called as gingivitis. So how does gingivitis starts? So when we don't brush our teeth properly, this is, can you see these whitish yellow areas on your teeth? These are deposits on your teeth. This is the hardened plaque on your teeth. When you don't brush, this starts forming on your teeth, and once this plaque forms, the gums become swollen and they tend to bleed. So whenever if you notice even a slightest of bleeding on brushing, and especially brushing your gums, you must visit your dentist ASAP so that we can teach you good brushing, how to brush your teeth, and especially how to brush your gums to keep them healthy. So brushing, what the myth is that we must brush our teeth. No, it is not just our teeth. Brushing is also for the gums. I would say that rather brushing is more for gums than for teeth. And if your gums are bleeding, it's because you not probably you're not brushing very well. And the answer to it is also good brushing on your gums. So this is a very, very advanced gum disease, or what you must have heard in a rural language that you're getting pyorrhea. It's a very common word in rural villages that people say, I have pyorrhea in my mouth. So this is the advanced, if you don't brush and if you let all this dirt and hard tartar or calculus deposit on your teeth, then your gums will go down. And once your gums goes down, what is under the gum is the bone. The bone also goes down. And when the bone goes down, the teeth, they are not in the bone. So they start shaking and they lose the bone support, and slowly they will shake, and then they can start falling off on their own also. So as a teenager, as a youngster, you should be very, very careful that you don't get gingivitis, you don't start this disease, because if once this disease starts and you don't take care, this is how it is going to progress. So what are the most common causes of gum disease? The biggest common cause of gum disease is not brushing well on your gums and not taking care of your hygiene, not flossing, not using a mouthwash. This is something which is true for every human being. But then there can be some other causes or which can aggravate your gum problem, that is your diabetes, your tobacco chewing, your smoking, all these some systemic diseases as well can aggravate your gum problem. But the most common cause which we all face, or the reason, is the brushing, the flossing, and your mouthwash. So these are the most common causes: the improper oral hygiene, no flossing or using any interdental aids, diabetes, smoking. Some medicines can also aggravate your gum disease, poor immunity, and to some extent, the diet also plays a little role in having healthy gums and healthy teeth. So another myth, biggest myth is when we say that you must go to a dentist every 6 months and rather have your teeth cleaned. Everyone, when I tell anyone that you need to get your cleanings done every 6 months, that is what we recommend as a dentist. They'll say, no, my teeth will become weak if I clean my teeth. My enamel will become eroded if I get my teeth clean. So they have this fear and they don't want to get their teeth clean. Oh, I heard that gaps will come between my teeth. So these are the various myths which surround the treatment of the gum disease or prevention that we do for gum disease, that my teeth will become weak or get eroded and stained after scaling. My teeth will become sensitive or gaps will appear between my teeth. I brush every day, then why are my gums bad? I use super soft brush or don't brush my gums when they bleed. So when the gums bleed, you tend to not brush on the gums. That is where we go absolutely wrong. The bleeding from the gums is just a sign, but that doesn't mean you still don't brush your gums. You must still brush your gums and go to the dentist so that we can clean all the dirt that has deposited and we can find the right cause of your gum bleeding. See, these myths basically come from this advanced gum disease. What happens is earlier, when people would not go to a dentist, they would come or land up in a dentist's chair with these kind of dirty teeth. So, when you have these dirty teeth, so when we remove all this tartar that is deposited on your teeth, you will actually feel that your teeth have become elongated or there is some empty space in my mouth, or these, when the gums have gone down, the roots show up. So those roots are little sensitive. You may not feel sensitivity at this stage because they are covered with all this dirt. Once we remove the dirt, you may feel little sensitivity for few days, maybe for 5 7 days, but that sensitivity is always transient and we can always correct it. There are ways to control that sensitivity. And some people think that my teeth are shaking after we've got them cleaned. But if you look at this picture, it's only this dirt wall which is not letting you feel that your teeth are shaking, but they're actually shaking. So when we remove that dirty wall or the hard wall of dirt, then you actually feel how much your teeth are shaking. But I can assure you that no scaling or cleaning can shake your teeth further than what they are already shaking. So that is just a myth and not to be considered. So then how can we prevent gum disease? We have to brush twice a day. And not just brushing your teeth, but brushing your gums also. So there is a correct way to brush, and that is more important than how many times you brush. You may be brushing 5 times a day, but not brushing correctly. Still, you will end up with gum disease. You have to floss every night, mouthwash twice a day, rinse after every meal, visit a dentist, and get cleaning done every 6 months. This should be the mantra of your life. If you want good, healthy teeth all your life, visit a dentist and do get your cleanings done regularly. Stop smoking, tobacco chewing, and you should have strict diabetes control to have good gum health. Now, coming to another very common myth or a very common prevalent disease, that is irregular teeth. What we in our dental terms call it as malocclusion. That is, your teeth are not aligned properly. So the myth is that I need to correct my irregular teeth only when I am small, not when I'm older or when my permanent teeth have come out. I can't correct my teeth now because I'm an adult. I can't correct my irregular teeth as it is embarrassing to wear braces as an adult. So let me show you how. So there are two reasons why we have irregular teeth. One is because our teeth are enclosed, or we have jaws or the bones in which the teeth are housed. So we have this upper jaw, we have this lower jaw. So when there could be two reasons why the teeth are irregular. One is that your jaws have not grown properly. The jaws are either small or big, or one jaw is growing too fast and the lower jaw is not growing very well, or vice versa. The second reason could be that the jaws have grown properly to the proper size, but the teeth are crowded. There is no space for teeth to align. So we will talk for each one of them. So this is when your jaw is way backward. Then can you see, if you look at her face, her this lip has gone in, the chin is inside. So you will never have a good profile or good shape or good structure of your face. So that is why it is very, very important that your jaws grow well. And for us to treat these jaws, ideally you should be visiting a dentist before 13 or before 12 years of age, because that is the time when the jaws are still growing and we can correct your jaws. Even if some jaws growing faster or slower, we can correct that at that growing age. And once as an adult, we can't do too much about your jaws. We can only correct your teeth, but we can't give you a different face structure once you have become an adult. So it's very important for a child to start visiting a dentist at least at 2.5, 3 years of age, so that we can keep monitoring how are their jaws growing. So this is the reverse of that, when the lower jaw has grown too much. Can you see the chin starts protruding out? So if you see her face structure, we can't correct this if you come to us as an adult. But had you come to us or with this same problem at 8, 9, even 6, 7 years of age, we could have easily corrected this jaw growth to quite an extent. Then there are certain habits which, as an adult, as a child, which has a total effect on your teeth and on your jaws and the alignment of your teeth. And one of the most common habit is mouth breathing, that we breathe through our mouth. We sleep with our mouth open. In children, you can have thumb sucking, you can have bottle feeding, you don't swallow your food in a correct way. The way you swallow your food is also very, very important, both for a child as an adult. And all these habits need to be broken, and we as a dentist can help you to change these habits of yours at any age, both as an adult and as a child. And this will definitely have a beneficial effect both on your jaw growth and even on your airways and your other general health. Now the myth that I can't wear braces because I'm too old. Then there is something called as invisible braces, or they are called as aligners. So here you can see, this is a picture of Justin Bieber who is wearing these aligners. You can hardly make out that he is wearing a brace. So these aligners are most popular with adults. Even children nowadays don't want to wear conventional braces, and they prefer these really aesthetic looking aligners. So most of the irregular teeth, even as adults, can be treated with aligners. So there is no need to feel shy that how will I correct my teeth at this age. So there is always this aspect to it. Or if you don't want to wear aligners, you can wear in white colored braces also, which don't show much. They still show, but not as much as the steel braces that you wear as a child. So that was about irregular teeth. So if any one of you has irregular teeth, you must visit your dentist, and you can still correct your smile at this age also. We have people as old as 50 years, 60 years who come to us to get their smile corrected. Then coming to the myths about dental surgery. That if we need an extraction and if we extract our teeth, it will have some effect on our eyes. Very commonly asked question, especially people from rural areas, a little uneducated people will always ask you, oh, if I get my tooth extracted, will it affect my eyesight? No, it will not. There is no relation to tooth extraction and anything to do with your eyes or your eyesight. If we extract teeth, how will I chew? One or two teeth when you extract, you can still chew if you have rest of your teeth intact. So, but then there is again help. Once you extract the teeth, ideally you should be replacing that tooth either with an implant or with a bridge or whatever way your dentist suggests, so that you can still chew your food as well as you could before extraction. I can't have implant immediately when I extract my tooth. No, I will come to this myth also. I can't have fixed teeth when I grow old. No, you can still have fixed teeth even if you are 80, even if you are 90, we can still give you fixed teeth. Implants are not safe for older people. So I'll come to all these myths again. So this is what is called as an immediate implant. That when we extract a tooth, so this is the root of the tooth. We extract a tooth and in that same socket, in that same empty space, we put a metal root. So that is what is called as an implant. And then depending upon what your condition is, your dentist may suggest that I'll put a crown or a tooth on top soon after I give you an implant, or maybe 3 months after the implant has become embedded in your bone. So these are called as immediate implants. So it is a one-time procedure that you extract the tooth and you put this metal root, and later on, soon after, maybe in a week's time or after 3 months, you can have a full working tooth like your normal tooth here to give you a chewing tooth. So this is how this is an implant, this is a little connector, and this is how you put a cap on it, and you can have a good looking normal healthy chewing tooth. So if that was a single implant, then you can have full mouth implants also, especially for older people. Earlier they used to wear dentures, and sometimes, as they grow old, when they wear dentures, the bones go away. The denture is not stable. They eat food, the denture comes out. They talk, the denture comes out. And nowadays, nobody wants to remove those dentures or nobody wants to wear those dentures. So then you can have these implants supported bridges like this. So you can put 4 to 6 implants in a jaw and we can give you a full set of teeth. And people say, oh, I'm old. How will I do it? No, these procedures are mainly done in older people. It's only old people that have dentures in. So all these procedures are basically done for older people, and if you are medically healthy and if medically you have no problem and your doctor allows, we can give you your full set of good chewing teeth, and you can chew, you can really eat your food, you can eat your salads, you can eat your nuts. So they function almost like your normal teeth. So this is a picture. So can you see how many few teeth are left in the jaw? So we removed the teeth for this lady and see she is wearing an implants. These are the implants and these are the teeth on top of it. So we can do this, even give you these kind of teeth in 2-3 weeks time. We can give you a full set of teeth with implants in one go. So that is how you can replace implants and teeth. Now coming to, as I was talking to you earlier, one of the biggest or the most upcoming this thing is branch is the airway dentistry. And we all know in COVID times how important it is that we breathe well and we get good oxygen for our body. So snoring is till now it was considered as a habit, and we would probably laugh it off. If your friend is snoring, you'll, oh, he was snoring at night, when we would all have a good laugh. We may record his snoring and we will tease him in the morning. See, you were making noises. But let me tell you, snoring is no longer considered as a laughing matter. It is no longer considered as a habit. It is really, really a health hazard. Snoring can eventually lead to something called as sleep apnea. Sleep apnea is something where you are not taking enough oxygen into your body, and then when you don't take oxygen, you can imagine your body is not getting oxygen. So many other diseases can start, right from hypertension to stroke to everything. The oxygen can affect so many systems and body parts. So you need to prevent snoring, so that if you don't snore or you treat snoring at an earlier age, you can prevent yourself from going into sleep apnea, or even it is called as obstructive sleep apnea. So it leads to sleep apnea, which can lead to many other systemic problems, as I've just talked to you, along with sleepless nights, loss of energy, daytime sleepiness. These all are symptoms of sleep apnea. That you're, going in a car in the daytime and you fall asleep so easily, you fall asleep in front of TV. So all these symptoms may be showing you, or you waking up very frequently at night to go to the washroom. It could also be a symptom of sleep apnea. So you must, if you are snoring, you must visit a dentist or a sleep medicine person to evaluate whether you are snoring or you are in sleep apnea. If you are just at a snoring stage, then as a dentist we give you anti-snoring appliances, which look like something like this, which you wear at night, and you can sleep with these appliances. Even mild sleep apnea also, we as a dentist will give you an appliance to help you sleep better. So this is snoring is something which happens to adults, but the same snoring can even happen in children. And what are the signs that you will see in children? They don't have snoring like adults do. They may have noisy breathing, or they may be breathing through their mouth. They have tonsils, they have frequent coughs and colds. You may have a hyperactive child because he didn't have a restorative sleep at night. Even adult, if you don't get a good restorative sleep, you may be very cranky in the morning, or you may be completely fatigued. Daytime fatiguability will come. You will have low energy levels. Or in children, you can even have attention deficit syndrome or poor scores in the class. It can even you can have a little foggy brain in the morning, both as an adult as a child. If you are snoring and you have a sleep disordered breathing, daytime sleepiness, wakes up with great difficulty in the morning. Some children may be bedwetting, and the cause could be because they are snoring or they're not breathing well. Wake up frequently at night. You keep tossing in bed. Forward head posture. Whenever you are not getting enough oxygen or your mouth breathing, even as an adult, you will tend to put your head forward like this. So your whole body posture becomes abnormal, and soon you will feel that you start getting muscle pain. You will get muscle pain in your upper shoulder, your neck, back of your neck. You may get some muscle pain here, or you may get headaches, which we call as tension type headaches, something similar to tension type headaches here, tension in your jaws, you chew your food, your muscles are fatigued. So all these could be a part of this problem, that is not getting good oxygen in your body. So even when you're not, or you're snoring as a child, again your jaw bones will not grow, and as an adult you can have irregular teeth. And these are frequent colds, coughs, and tonsillitis if you're breathing through your mouth and not breathing through your nose. So that was about snoring and sleep apnea. Now let's come to a little bit about aesthetic dentistry or cosmetic dentistry. You say that I have to live with discolored teeth. No, you do not. You can get your teeth cleaned and you can have them bleached like we bleach our face, we bleach our hair, and you can definitely change color of your teeth to some extent. I can't change the shape of my teeth. No, you can still. How I will I will just show you. I can't do anything about my irregular teeth. One, I told you that you can do invisible braces to correct your irregular teeth, or if you have spaces or you don't want to do the braces, then you can even do something called as smile design. So for smile design, there is something called as dental veneers, which we do very frequently. So with dental veneers, we can you see this tooth? This is got space around it. This is small in size. This is rotated. So like nowadays you have artificial nails. Similarly, we call them tooth veneers. They're really very thin, almost like 0.3 millimeter, 0.5 millimeter in thickness, and we can put them onto your tooth and you can have a good looking tooth like this over here. So this was a tooth which was small, which was discolored. We can put a better looking, better colored veneer on it and you can have a full looking tooth here. And not just for one teeth, you can do it for your whole set of upper front teeth, upper lower teeth, and we can completely change your smile. So who says dentist doesn't make a difference? All of them you can see have had dental treatment. So let this motivate you to go to your dentist and have a better smile, to have better confidence as well. So a basic carry home message. You must visit your dentist regularly, maintain good oral hygiene, restrict your sugar exposures to not more than 3 times a day. Watch out for habits of snoring, mouth breathing, and a good tongue swallowing, a good swallowing habit. You can go to maybe YouTube or you can go to online and learn good breathing habits, good swallowing habits, how to swallow correctly, and learn these good habits to have good facial structure and to have good oral health. You can always replace your missing teeth. You must practice prevention. Go to dentist if you're getting cavities. Learn about fluorides. Get your fluorides done, your sealants done, and there's so many other ways we can prevent decay. And if you are unconfident, you don't like the shape of your teeth, you can always do a good smile design and get back your self confidence. So thank you.
Thank you so much, ma'am, for this detailed presentation. And ma'am, definitely dentist can do wonders. Really. Ma'am, yeah. Thank you so much, ma'am, for this detailed presentation. And definitely dentals can do wonders.
I
Uh,
agree
ma'am,
with
I have I have some questions. Like, what is the difference between orthodontist and endodontics?
Okay. Orthodontist is the one who corrects your irregular teeth. So in dentistry, you have different specialities. So like pediatric dentistry is one specialty. Orthodontist is they will start correcting a child's teeth when normally the initially till about 12 years the child will be going to an orthodontist to get their teeth sorted, but once they need full-time braces we hand them over to the orthodontists, so they are the ones who actually put braces as an adult, or maybe early from 9 year old to 12 year old children as well. So they are the ones who puts braces, they are the ones who are doing these invisible braces, the aligners, they are only done by orthodontist. Endodontist is the root canal specialist. So he is the only one who will be doing root canal treatments for you. So they are trained to do root canals.
Okay.
So then there are so
Okay.
many other different specialty like this, like an implantologist. He will do implants for you. You have oral surgeon, maxillofacial surgeon, who will do traumas, the fractures, tumors, even implants. So the surgical part is taken care by them. So they're different. There is a separate cosmetic dentist. So like
Yeah.
I've been trained as a sleep medicine person, dental sleep medicine. So you have a specialist of dental sleep medicine. So likewise, you have about 15 dental specialties.
Okay,
Yeah.
15 special. Oh my God.
So you have
So
many.
our teeth have this 15 special, army forces for
You have
us.
a gum specialist. So there's so many.
Okay. Ma'am, the nowadays the world have become so faster. So everyone wants their teeth to become white very faster. So nowadays of charcoal toothpaste and all that ads are coming. So should we use it or we have to stick on our regular toothpaste?
See, charcoal toothpaste, the one which they are making right now, is still okay because they are not very abrasive. Earlier, the charcoal toothpaste was so abrasive that they would actually strip your enamel. So you can do any toothpaste. Actually, it really doesn't. The bottom line is your toothpaste must have a fluoride if that's the only anti-cavity thing you have. So your toothpaste must contain some fluoride to prevent cavities.
Okay. Ma'am, as you have been practicing dentist for so many years and you have so experienced, so ma'am, you must have some patients like, you must have shared some funny incidents. So share something with us.
Okay. Okay, I'll share a small anecdote. And that's
Okay.
still stuck in my head because it happened when I was just a student.
Okay.
So I come from Punjab. I graduated from a Punjab dental college. So it's a rural language, but I'll translate it for you. So
Okay.
there was this old man who had come for dentures. So while we do dentures, the we ask the patient while we are taking their size and everything to touch your tongue to the palate that is inside
Yeah.
while we are taking the size.
Yeah. Okay.
So I had one of my colleagues who didn't know this rural language too much. So she's trying to tell him, Babaji, Babaji means old man, uncle, Papaji, whatever. Please अपनी tongue को छत ना लाओ. Chat means roof na lao. Touch your tongue to the roof.
To the roof.
He started with his legs up and he was like, tongue in Punjabi means legs. He was
Oh.
touching his legs and he was like, so then I had this another kid, I remember, very small, who was like little scared to come to a dentist. She had little phobia, but her mother would bring him and she comes into my clinic and she tells me, Doctor, you know what? What? I have this dog. Okay. Tommy. I don't remember the name of it. Tommy. I will tell him, shoo, doctor. Go, shoo, doctor. I'll bring him this. I will tell him, shoo. So you better beware. So they start scaring us. Can you please be nice to us? Otherwise, my dog behind you.
That's funny, ma'am. Oh, ma'am, I thank you once again for your comprehensive and detailed presentation. And ma'am, for sure we will remember your mantra that you told us
Go
for
to
our
a
healthy
dentist
teeth.
every 6 months. Let your teeth be dentist's headache and not yours.
Yes, ma'am,
And
we will
always
remember this mantra.
listen to what he has to say to you.
Yes, ma'am.
And
Thank you
I
so
can
much,
promise
ma'am.
you will have healthy teeth all your
Yes,
life.
ma'am, for sure. Nowadays, ma'am, I'll take care of my teeth very properly for sure
Yeah, please.
after listening you.
Yeah.
Okay, thank you so much, ma'am, for your
Welcome.
very, wonderful presentation. And it was a pleasure to have you, ma'am. Thank you so much for
It
being
was
with
my
us.
pleasure to tell you all this and to be of any use to you. Thank you.